An adult mouth typically contains 32 teeth, but did you know by the age 50, the average American has already lost 8 permanent teeth? It's America's silent oral health epidemic, tooth decay. And our next guest is desperate to save her smile.
Hi, my name is Charlotte. I just turned 45, and I've had my fair share of dental decay through the years. I've had a few cavities, a crown, and I actually have a front tooth implant. Recently, I've learned that I need a crown. One of my back molars is cracked, and I know that if I don't get the crown and get it fixed, that it can break off and cause all other kind of issues. Dental drama runs in my family. While my mother is 74 years old with absolutely perfect teeth. My dear father, who passed away in 2018, he dealt with some dental decay and dental struggles through the years. He had cavities, he had a few crowns, and ultimately he had dentures. And I don't want to struggle in the same way that he did, when I get older. We always hear about the do's and don'ts of skincare in our 30s, 40s, and 50s, but I don't really know much about what to do with my teeth as I age. Is there some type of routine that I can start now, because I don't want to lose my teeth?
Charlotte joins us today along with dentist and Crest spokesperson, Dr. Stephanie Kaplan. Ladies, welcome to the show.
Thank you. Thanks for having us.
So, Dr. Kaplan, when it comes to dentistry through the decades, what do we need to know?
It's important to know that 7% of Americans have lost at least one permanent tooth by age 17 due to tooth decay. That number increases to 60% for those in their mid-30s to early 40s. In our 40s, receding gums become more problematic, and often this is the result of years of aggressive brushing. Exposed roots and increased sensitivity can lead to an increased risk in tooth decay. In our 50s, decreased saliva, also called dry mouth, becomes an issue due to hormonal changes. And as we know, saliva is crucial to teeth health.
And I have another scary stat. Nearly 1 in 5 adults, 65 and older, have lost all of their teeth. I mean, that's staggering. Dr. Kaplan, clearly decay is a huge concern. What more can you tell us about that?
Just like our bones, our teeth lose density over time, and this can lead to decay and wear them down. And tooth decay is damage to a tooth surface or enamel, and this is caused by plaque acids. Tooth enamel is considered the hardest mineral substance in our bodies. It's actually stronger than bones, but despite its strength, everyday acids that develop from certain foods and drinks, particularly those that are sweet or contain starch, can put enamel at risk. Bacteria in your mouth combines with food and it forms a sticky film, and this is called plaque. Plaque bacteria produce acids that can weaken or destroy enamel. And acids can attack and soften the tooth surface. And once your enamel is gone, unfortunately, it can be gone for good.
Charlotte, when it comes to the topic of healthy teeth, you have some additional concerns. What are they?
Yes, well, Dr. Orton, I have 2 teenage boys with braces. And getting them to brush regularly during COVID was definitely a huge challenge. And telling them that they can't have certain foods like popcorn at a movie theater or other foods that they enjoy is really hard because of their braces. So decay is definitely a huge concern. I'm trying to get ahead of any problems and get them on track right now so that they don't have major decay issues down the line.
Dr. Kaplan, tell us, what are the first signs of tooth decay we should be watching for?
A telltale sign would be a white spot that appears on the tooth. It may darken to a brownish color as enamel continues to break down. It can even escalate into a toothache, tooth sensitivity, a cavity, or even infection. I also want to make note that tooth decay often occurs on the back teeth, and this is because they're the most difficult areas to clean. They have grooves and pits, and they also have multiple roots where a lot of food particles like to accumulate.
Charlotte, tell us, what's your oral care routine look like now?
I admit I drink a daily coffee and the occasional red wine, but I do brush twice daily. And if we have mouthwash in the house, we'll certainly use it. but we don't prioritize it. But I do try to floss daily as well. I'm definitely due for a dental exam, full disclosure. I haven't been to the dentist for a cleaning and for the routine needs for quite some time due to COVID. So COVID kind of threw a wrench into that process.
Charlotte, you are overdue. You're not alone. This is something everyone has dealt with, as I alluded to. Remember, it's important to get regular checkups and dental cleanings every 6 months. And Charlotte, something else that would be great for both you and your sons is to make smart food choices by limiting foods and drinks that are high in sugars and starches. Dr. Kaplan, beyond that, anything else you would recommend?
I do think that Charlotte and her sons would benefit by rebuilding their enamel each time they brush with a targeted toothpaste. And for this, I recommend Crest Densify Daily Protection. It actively rebuilds tooth density to extend the life of teeth every time you brush. And the 2-time enamel protection system remineralizes weakened enamel while also preventing demineralization. You can find this Crest Densify at Walgreens and walgreens.com. Today, Charlotte, I would like to get you and your family started with Crest Densify Daily Protection with a 1-year supply.
Wow. That's awesome. Thank you. Thank you so much.
You're welcome. You're
well,
welcome.
Charlotte, you're on track now. Thank you so much for joining us and sharing your story. Best of luck to you and your family.
Thank you so much. This has been so great. I can't wait to get my routine started.
And Dr. Kaplan, thank you so much for all your expertise.
Oh, you're welcome. Thank you. I had a really wonderful time.
Well, we've all learned something here today. It's not only important to brush daily, but densify daily for teeth that last.